Make a small vertical groove, engage the tip of the keratome, advance forward, and then enter into the antechamber. This is the main incision with a 2.8 mm keratome. Dear colleagues, this is phacoemulsification of a cataract with grade 3 nuclear sclerosis. The main incision has been made, viscoelastic substance has been injected into the antechamber, one side port has been made on the right side of the main incision, and this is another side port on the left side of the main incision. This is an unedited phacosurgery. Now capsulorhexis is to be done. Incise the anterior capsule with a 26 gauge bent needle. Now hold this flap with a utrata forceps. Rest against the anterior lip of the main incision so that leakage of viscoelastic substance becomes very minimal, antechamber remains formed, and you can complete capsulorhexis without shallowing of the anterior chamber. The rhexis is made. This is a fairly round capsulorhexis. Now hydrodissection is done. Fluid wave is burst underneath anterior capsular rim. It goes to the other side behind the nucleus. Tap the nucleus and rotate the nucleus. And now is the time to enter into the eye with the phaco handpiece. This is Oatley Cataract's easy phaco machine. The phaco chief is introduced. I am in phaco 2 mode from the very beginning. Sculpt a little bit to go at a deeper plane, advance forward, and then chop the nucleus with a keratome, with a chopper. This is a very small chopper. It is called micro chopper. This is another chop. So the nucleus has been divided into several parts, and this is emulsification of each fragment. From the very beginning, I am in phaco 2 mode, and in phaco 2 mode the ultrasonic energy in this case is 60%, flow rate is 45 ml per minute, and vacuum is 450 millimeter of mercury. This is the last fragment. Antechamber is very stable. Now all the nuclear fragments are removed. HPMC is injected, and a Simcoe cannula is being used to remove the lens matter, cortical lens matter. When we inject viscoelastic substance in the antechamber, the antechamber remains formed, and we can remove lot of viscoelastic substance without shallowing of anterior chamber. Now I go through the right side port in this case and remove rest of the cortical lens matter. And now is the time to implant an intraocular lens. HPMC is again injected. In this case, I have selected a hydrophobic acrylic single piece intraocular lens. The lens is loaded in the cartridge. Both the haptics should be on the anterior surface of the optic of the lens. The lens is advanced towards the tip. Now it is placed on the injector. Now the piston is advanced and the lens goes towards the tip of the cartridge. In this case, I am enlarging the main incision a little bit by about 0.2 mm, and the incision size has become about 3 mm. This is for easy delivery of the intraocular lens without stretching of the main incision. The trailing haptic has stuck to the side of the optic, and it has been teased and released. Now, the lens is dialed, the posterior lip is depressed, and some amount of viscoelastic substance come out, and now I'm going to spend about 1.5 minutes to remove the viscoelastic substance. First, I'm using the Simcoe cannula. I'm irrigating the area behind the IOL. I have irrigated in front of the IOL so that a lot of viscoelastic substance come out just by irrigation of BSS. That's it. I take BSS directly from the bottle for this irrigation. And now irrigating probe and irrigation aspiration together I used to remove the rest of the lens matter. Thorough removal of viscoelastic substance is very much needed to prevent post-op rise of intraocular pressure. And now the side ports are hydrated and these wounds become waterproof. Now this is the final wash. I go to higher magnification and see what happens. Viscoelastic substance which sticks to the corneal endothelium gets dislodged by this irrigation and it comes out. Thus, I ensure 100% removal of viscoelastic substance. That's it. Hope this video will help you, will encourage you to develop your surgical skills. Thank you very much for your eagerness to watch this video.